When it comes to your heart health, you can help yourself by staying physically fit and eating right.
And you can help others by knowing what to do in a cardiac arrest.
It doesn't get any more important than this. So stay tuned to Health Talk.
We're up next.
Hello, I'm Dr. Vicki Smitak.
And I'm Dr. Eric Mazer. Today we're going to talk about cardiac arrest with Ann Bartolone, Director of Cardiovascular Clinical Operations, and Nancy Capelle. She's a cardiac educator. And we're going to talk about what people should do at home about cardiac arrest because it can be life-saving.
Right, and cardiac arrest, heart attacks, these words get sort of mixed together and used interchangeably, but we know that they're actually two different events. And maybe we can start by that, and then I really want to hear your story. We want to hear your story, Nancy.
Sure.
But tell us first the difference between a heart attack and a cardiac arrest, because there are differences, right?
Yes, they are definitely differences. So if we're talking about a heart attack, we're really talking about a plumbing problem within the coronary arteries of the heart. And so there's a type of blockage.
That's what I tell the cardiologists, that they just do plumbing.
Right, it's plumbing, right? It's plumbing. This is, so everybody...
Anna's going to beat me after the show.
And, you know, there can be a blockage, and that blockage can happen for a number of reasons. But when that blockage occurs, it cuts off blood flow to a portion of the heart muscle. That heart muscle begins to die. The symptoms become the chest pain, the radiating pain up through the neck and jaw, into the back, maybe down the left arm. The person may be sweating profusely. They may feel like they're going to get sick. And that's the heart attack. But that person who's having that heart attack, they are still alert, they are still able to talk to you, they still have a pulse, and they're still breathing. And so that's an immediate call to 911.
Mm-hmm. Right, that's, you don't wait. And the other thing is, as we had discussed before, heart attacks are often mischaracterized on television as somebody clutching their chest and fall
right.
and losing consciousness. Yes. And you can lose consciousness with a heart attack because you're not getting adequate blood flow. But you certainly don't need to lose consciousness in any way from a heart attack.
Right, and from a heart attack point of view, you know, the standard clutching the chest, having chest pain that you see in the media very often, symptoms can be very deceptive, especially for women.
And that's an important point, Andy. Tell us more about that.
So women's symptoms tend to be a little bit more focused on the stomach system, on the GI system. They tend to have more just feeling like a fullness in their chest or their stomach, a lot of indigestion, and a lot of the pain that even can be associated with a heart attack would be in the back or to the arm or to the jaw. And women tend to overlook those symptoms and just feel like...
Well, women think they don't get heart disease, which I know is a complete fallacy.
Right. So everybody's worried about cancer, but it's really heart disease, which everybody really should be more concerned about, and heart health.
So heart attack tells us that the heart is hurting, the heart is sick, but a cardiac arrest is really when you drop, when the heart is not conducting anymore, not beating, and that's, you know, all systems down, and that's the typical scenario that we see in movies and TV, but one doesn't have to necessarily lead to the other, as we heard you say. Now, Nancy, I know that I've heard your story told before, but maybe you can share it with us.
Maybe we'll ask the viewers at home to guess which one of us here.
Well, I gave it
among the four of us has had a heart attack and actually a cardiac arrest, and it was you, the least likely.
I win. Yes, exactly. So it was 1 week after my 40th birthday. It was the best birthday present, I guess, you could get, right? So Are
you saying that really or facetiously?
Well, yes and no. Yes and no. I had some very, very positive things have come out of it, but it certainly wasn't the present I expected. I was hoping for a mountain bike. So there's some discrepancy there. But I had run a 5K race in the morning, and when I got home, I started to experience pretty classic symptoms. So I was fortunate because those symptoms, because they were classic, I was able to recognize it a little faster.
And what were those symptoms?
And those symptoms were the chest pain that really felt almost like an esophageal spasm, you know, when you get something stuck about right here. And then the pain started to travel, which is very common. So it traveled up through my neck and into my jaw, around my back. The jaw pain itself was excruciating. I would say that was the #1 symptom.
But didn't you think to yourself, I just ran a 5K. I'm a healthy young person. I can't possibly
I'm a woman,
be having
I don't smoke,
a heart attack.
My cholesterol is probably 10.
Right. So did you call for help right away? Did you think that you were having a heart attack, or did you think that it was reflux or something else?
No, it took me about 45 minutes to really come to my senses. I figured it was either some type of muscle pull or something like that.
Right.
And I even had to go as far as to Google my symptoms. Because I guess that's what we do. That's what we do. So I was actually having a heart attack, and I was Googling my
Which,
symptoms.
by the way, we're not recommending.
No,
for
we're
people
not
at home.
recommending.
Maybe you can say something about that too.
But with no family history of any type of heart disease, and being a woman and being young and being athletic, I mean, and a non-smoker, I had absolutely no risk factors, at least that I knew of. It turns out that I actually did.
So how did you get medical attention? Did you eventually
So
call
yes,
911?
we eventually called 911, and EMTs, paramedics arrived, and they did an initial 3-lead EKG, and that showed them that, in fact, I was having a heart attack.
Wow.
Yeah.
Now, did you go on to have a cardiac arrest with your heart attack?
Yes. So
I do want to say that you did one thing wrong and one thing right. You waited 40 minutes, and maybe we can emphasize that if you are having, you at home, are having symptoms of chest pressure, anything that goes into the joint, anything like that, go to the emergency room, because you're safer there, and also time is heart muscle. There are ways to reverse that.
Right. And if you're wrong, nobody's going to think any
And
less
nobody's
of you,
going to,
which
again,
I think
people,
is very important.
I think people, I don't
hear.
want to bother them, I don't want to, oh, come on, especially men, I think, are that way, but
women,
40-year-old woman.
Women are very unlikely to actually call for help because of that sense of, oh, I might be inconveniencing somebody, or I don't want to be embarrassed if it turns out. Well, it's better to be embarrassed than dead.
And that's why I'm saying it, really, because I think, as women, we don't want to bother anybody, and we want to, do it all. But, if you're having chest pain and all these symptoms that are pretty classic, or even if they're not so classic, especially if they're not so classic,
absolutely,
you really need to take yourself in and get checked.
And Nancy, but then you made a decision that saved your life.
I certainly did.
You called 911 and had an ambulance pick you up.
Exactly.
And as I recall the statistics, somewhere between 30 or 50% of people with heart attacks drive themselves to the hospital.
It's actually 50%. We have an emergency angioplasty program at Norwalk Hospital, and we find that consistently 50% of our patients will drive themselves in or have a family member drive themselves in. Which is wrong.
And we're going to explain why that's wrong. But if you suspect you're having a heart attack, go quickly and call the EMTs.
Right. Absolutely.
Call the ambulance.
And
do not drive yourself in.
Right.
And
it's
as
not
an
embarrassing.
EMT now myself, through life transition, I can tell you firsthand that when you call us and we arrive and it turns out not to be serious, let's say, it's fine, because that's what we're there for. So now I'm very fortunate to be able to see the other side, that you are not inconveniencing us at all.
So we have about 2 minutes left in this segment. Now you're going to stay with us for the whole show, but tell us the rest of the story. So you call the EMTs, and then what happens?
So then they are planning to take me down to the hospital. I'm actually loaded into the ambulance, and it was very shortly after that, we hadn't even left my driveway yet, when I went into cardiac arrest.
What did
so
you
that
feel?
means your heart stopped. Heart stopped working.
It's basically the electrical activity in my heart became chaotic. And when that happens, the heart is not able to pump blood anymore.
Right.
So I stopped breathing. I lost my pulse. I was unresponsive. Clinically, I was dead.
Right.
Yeah.
Yes.
Did you realize you were going out?
Yes.
And so you still have memory of that?
I have very vivid memories of that, yes, yes. I felt my heart fluttering and almost in this chaotic sense, and I said to the paramedic, my heart is going crazy, and he said, I know it is, because he could see it on the monitor, and he said, stay with me. And I tried to stay with him, and I just couldn't. I felt like I was falling backwards, and then that was it. That was the last I remember until I came back to life.
And then you found yourself in the emergency room. Is that where you came
I found
back?
myself still in the back of the ambulance.
So it was a quick and
it was a very quick. And,
but you had suffered a cardiac arrest, and you were in an ambulance, so they were able to shock your heart back to a normal rhythm.
Absolutely. So I was in one of the best places you could possibly imagine. Had I delayed any longer, had this cardiac arrest occurred in my kitchen with no first responders there, the outcome would have been very different.
You make a compelling argument for folks to call 911 when they're having symptoms that are worrisome. You really do, because like you said, if this had happened anywhere without trained personnel or a defibrillator, which we'll talk about a little bit on the next segment, the outcome may not have been what it is.
Or a family member who knows CPR.
Yes, which is so important because your heart had stopped effectively working. It was not pumping blood. And CPR can tide people over until that rhythm can be restored. I guess what a lot of people don't realize is the heart is governed by a very coordinated electrical impulse that spreads around the heart and causes it to pump effectively. When the heart is damaged because of lack of flow, that electrical rhythm may be disrupted, and there certainly may be enough heart muscle left to pump fine, but the rhythm doesn't allow the heart. It sort of looks like a bag of worms. People describe it, wiggling.
It's fluttering or wiggling.
It's fluttering away. It's not pumping any blood, and it will stop doing that after a short period of time because it doesn't get enough, because it's died. But if you can keep the heart perfused, keep oxygen going, food going to the blood, to the heart and the brain, until you get that rhythm back, you can bring someone back to life.
So that's why CPR is critical, and we'll talk a little bit more
about that. And we're going to talk about that in the next segment. So I think you've made this, I know, your life to teach other people. That's so important. So we want to come back in the next segment to teach you something about hands-only CPR and what you should do if you're around somebody, and it will usually be your loved one, who's having a heart attack.
Because it'll save their life. We'll be back after a short break.
Hi, we're back with Ann Bartolone and Nancy Capelle. We're talking about what to do if a loved one or someone has a cardiac arrest right near you. And we have somebody, obviously an imperfect person, a mannequin right here. But we actually have a video that we're going to show that's a little bit more realistic. So we'd like to bring up that video because it's a model of what someone should do. So here's somebody on the floor, and what's she doing right there?
She's checking for responsiveness, so it's the tap and shout. So it's tapping the shoulders and saying, "Are you okay? Are you okay?" And while she's doing that, she's also looking to see if there's any chest rise, if the person's breathing. And when she sees that there's no responsiveness and that there's no chest rise, then she immediately starts doing chest compressions at a rate of 100 per minute.
Now this is actually in the hospital, so she's breathing, using that device to breathe for the patient, but that's not what's going to happen in the field, right?
That's correct. With the hands-only CPR, what we're promoting is that people give the compressions, not worry about the breath, not worrying about the mouth-to-mouth resuscitation, but just focus on the breath, on the compressions, and make sure they're nice and effective compressions.
And that's been a change. That's a change now. And you maybe emphasize that, is that there's now information that the chest compression is the important part of this in the field.
Because that's what's getting the heart pumping and getting the blood circulating again.
Right, and the other thing that they didn't really focus on in the video, but if you noticed, you saw that the other person went and called for help. And that's very important that somebody be calling 911.
Yeah. And what's she doing there? That this is an automatic external defibrillator. These are available now around in stores and restaurants. She just put on the pads, but what's she doing now? She's just sitting back?
Now she is watching to see the machine analyze the rhythm to see if it is indeed a lethal cardiac rhythm or if it is a normal rhythm. And if it is a lethal rhythm, then the machine will advise a shock.
So that's what's happening right now. They're sitting back and they're waiting for
the machine to tell them what to do.
And it's important
that's a good point to make.
And it's important that nobody be doing compressions at that time, because a machine can't analyze the rhythm if there's that kind of motion.
Now we have a machine here also that you're going to show us in a little bit, and maybe we can even practice and see what it's like for a bystander or a layperson.
Right. Can somebody use these defibrillators who have never seen them before?
Absolutely.
So, and I think that's the important point. This defibrillator, it's almost foolproof.
Yes.
So here we have somebody lying on the floor, and You've shaken them, they don't respond, they're not breathing. We don't feel for pulses because apparently, unless you're a trained EMT or a physician, there have been so many errors about that. So it's really they're unconscious and not breathing.
Correct.
You should initiate something.
Now, there's a certain technique that goes along with CPR, and maybe you can show us, Nancy, the type of compressions that we want to be doing, right? It has to be at a certain angle and a certain depth, because if we don't do it deeply enough with enough strength, we're not going to get the desired effect. I don't know if you feel like demonstrating on our friend here.
Absolutely.
I'll put you on the
That's
spot.
all she does is demonstrate.
We really emphasize high quality CPR. So what I'm going to do first when I see somebody who's in distress, now this person may look like they're having a seizure, or they may be taking gasping breaths. That is not normal breathing. The seizure activity is not indicative of the fact that they are alive. So we want to stress that. And it's the tap and shout, are you okay, are you okay? And at the same time, I'm looking for chest rise, and I don't see any chest rise.
By that, you mean evidence that they're breathing.
That they're breathing, exactly. And then I'm going to instruct someone, you call for help, call 911 and get the AED. That's very important because you want to start that chain of survival.
Sure.
And then I'm going to immediately place my hands in the center of the chest between what we call the nipple line. And I'm going to start doing my compressions.
Now those are pretty fast compressions. You're trying to go at a rate of
100 per minute.
Okay.
And I want to be compressing 2 inches.
And then you want to let it come all the way back up also,
Absolutely.
right? That's an important
And the
point
2
to make.
inches is important also because I think a lot of people, when they first do this, are too gentle. You do often break ribs doing this.
You do.
Yeah, there's nothing gentle about this.
No, there's nothing gentle about this.
And you should be feeling that breastbone move underneath the heel of your hand.
In fact, especially in older people, you will actually feel crunching and cracking upon the first few compressions, which is completely normal. There's calcification that builds up, and you have to break through that. You need to remember that this person is dead. You can't hurt them. All you can do is help them.
What if they're not on a firm surface and maybe you find someone in bed, I don't know, a loved one finds their spouse in bed. Should they be moved to a firm surface? Maybe you can talk a little bit about that.
Absolutely. They need to be taken off the bed and put onto the floor. Otherwise,
for the same reason, right?
Yes, otherwise the chest compressions will not be effective.
And the most common place you'll find someone is on the floor. And that should be the right place for them. You don't want to lift them up. The other thing that people don't realize, people that are unconscious, they should be lying down unless they're vomiting.
Yes.
A lot of people getting faint, people try to hold them up, and that further diminishes the blood flow to their head.
Right.
But let's talk about the AED. So you've sent somebody off, and has never seen one before in her life, but she knows that it can be life-saving.
Absolutely. So Anne's coming with the AED. And the very first thing you want to do is actually turn it on, because you want to make sure that it actually works. Otherwise, you'll be wasting time placing pads on the individual.
Such common sense points,
exactly.
but so important to make.
Connect electrodes.
It's actually talking to me now.
I don't know if people could hear that at home, but it said connect electrodes.
Right, and it's actually telling me to place these electrodes onto the patient. And
Connect
there
electrodes.
are pictures that show me exactly where I'm supposed to place them. So this will go on this side, which
And I
is
remember when medical students used to do it, they often
Check
place it too
connector
much
and
in the front of
electrode.
the chest. You really want it over on the side.
So that's on the patient's left side, and then this one goes up on the right shoulder.
So what
And
you really want is the electricity
Check
going
connector
through the
and
heart.
electrode.
Absolutely.
Yeah.
And the electrical activity in the heart actually originates from over here, so you want to create that line that goes directly through the heart. These need to be placed on bare skin, very important.
Check connector and electrodes.
Okay. So now, this is a trainer device.
Stand clear.
What it's doing now is it's analyzing
Analyzing
the electrical
now.
activity.
Stand clear.
And we
Point
don't
out
want to
that-
interfere.
Exactly. When you're pumping somebody, when you're actually doing that, that creates artifactual electrical activity
Correct.
that does not allow the computer to analyze the rhythm.
Exactly. So
What is it doing now?
What it's doing now is it has detected that there is electricity
Stand
in the
clear.
heart that it can work
Push
with,
shock
and it's
button.
actually charged and ready to deliver a shock. This is the point where we say, everybody clear, because
Okay.
you do not want to be touching the person. We press the shock button. I'm going to shock now. and then it will click, and you will see the person.
Stand clear.
You will see the person jump, and
that's not the person alive. That's the electricity from the shock causing the muscles to contract.
Absolutely, absolutely.
They don't jump out. It's usually a little bit of a
jolt.
Sure.
A jolt.
Yeah.
And then after you deliver that shock, you want to go right back into another 2 minutes of CPR. And the AED is wonderful because it actually counts down those 2 minutes, and it will tell you that it's about to analyze again.
So then you stop and you sit back and you let it do its analysis, and then it'll tell you if the CPR has been working, if there's activity now, if the heart has some activity, or whether you should shock again.
It will either say shock advised, so you deliver another shock, or it may say no shock advised, continue CPR.
Okay.
And that is a case where you just continue your chest compressions, and you do that for as long as you need to.
Now, if it detects a normal rhythm or an effective rhythm, will it tell you not to continue CPR?
It will say no shock advised. It will not tell you to stop CPR. It will say no shock advised. And even if you were to press the shock button, it would not deliver a shock. That's how safe these are.
So you could put this on me right now and go through it, and it would refuse to shock me, hopefully.
Hopefully, yes, absolutely. It wouldn't do anything. And so I think that's one of the big misconceptions out there, is that these are somehow dangerous, or you could actually put somebody into cardiac arrest who wasn't already in cardiac arrest. And that is not the case at all. And there also are laws in place, like the Good Samaritan law, that protects bystanders who intervene and try to help somebody.
And that's an important point to make also. Now, it won't deliver a shock if a shock is not indicated, so it's very safe. I get all that. What about breathing? I saw that in the video that we showed, they were breathing for the patient, but now the recommendations are that we don't do any breathing, that it's hands-only CPR, right? And we should probably talk a little bit more specifically about that, which is really what you're demonstrating here.
Correct.
Together with the AED or without the AED. So whether or not you have an AED, you should be performing chest compressions until help comes.
Right, and that's why it's so important that you have dialed 911.
Right.
Because as you're doing this CPR and you're doing multiple rounds of compressions, it is very tiring, but you do want to know that help is coming on its way, and that does help you through it. If this is happening in your home and this is your loved one, that the fact that you've called 911 means that somebody will be coming, and you can continue this as a tool to get to
Let's say your wife at home. And it's just you and your husband is down on the floor. What's the first thing you do? Do you call 911 first? Do you try to get some compressions first? So
no.
You call 911 first?
With an adult, you call 911 first. And then you can start the compressions if you're by yourself. Yeah. With children and infants, it's different. You need to deliver a full cycle before you leave that child to go call 911. They don't have the same reserves that we do. They need those immediate compressions. They also need the rescue breathing. Right. So the hands-only CPR is only just recommended for adults.
And that's a good distinction. Also the point that you made, Anne, about getting tired. I mean, this is, having done this myself a number of times, both on real patients. You know what, Erica? On the infants, it may not be as tiresome, but certainly on a larger child or an adolescent or an adult, as you're doing the compressions, and if you're doing them the right way, your arms are hurting, so you want to enlist the help of someone else. And obviously, if you're home alone, you'll do the best that you can. But it's certainly important to switch off, because, as you know, don't be a hero. Do what you need to do, but also get colleagues or other bystanders to help you.
And that's a good place for us to end. This has been incredibly informative. I hope people at home have found this as informative as I have, just because there is so much we can do, but there's so much misconception, a lot of it brought about by what we watch on TV. So this has been really, really helpful, Nancy. We're going to keep you on the set to answer our question, and when we come back, we'll answer it.
But right now, let's take a look at some of our upcoming events. This week's health question is, how can a layperson assist if he or she is in the presence of someone who suffers cardiac arrest?
So this is really a summary of what we were talking about. what do? You find somebody on the floor. What are the steps? Ann?
You want to check for responsiveness, that's the most important, and you want to check for breathing because you don't want to be doing CPR on somebody who doesn't need it, but you do want your second step to be to call 911, and you want to start compressions, you want to push hard, you want to push fast. And if there is an AED available, you want to get it and turn it on and apply it to the patient's chest and get started.
Good. So just as you showed us, are you okay? Are you okay? No
Right.
response.
Checking.
You look at the chest for chest rise to see if the chest is moving at all up and down. If it's not, you go right into chest compressions
Yes, you
and you
do.
shout call 911 if somebody else is around.
Exactly, and it's much better to give CPR to somebody who doesn't need it than to not do it at all.
Well, see, you didn't say, but we've only got a couple of seconds left. How do you put your hands to do CPR? How do you?
You use this part of your hand here, and that goes right in the center of the chest between the nipple line, and then you place your other hand on top. And you bring your body up and over the person so that
So you're using your body
you're
weight,
using
not
your
your
body
shoulders.
weight. You lock your elbows and you use your body weight because that will keep you from getting tired so quickly.
Okay.
And if you are lucky and you have a good assistant, you can end up like Nancy, who herself had CPR and was brought back to life from a situation that completely unexpected.
And now helps others and
And
teaches
that's right.
this.
And now you've devoted your life to teaching the communities to do this.
What a wonderful story.
Thank you both so much for coming on the show today. I
Thank
hope
you.
this has been as instructive to people at home as it has been to us.
Thank
if
you.
you at home have a question you'd like to ask Vicki and me on Health Talk, please contact us by email at healthtalk@norwalkhealth.org.
We would like to thank our guests today, Ann Bartolone and Nancy Capelle. And Eric and I will see you next week on Health Talk.
Bye-bye. Stay well.